Hi, my name is Louise Neal and I am a spinal physiotherapist here at Nottingham University Hospitals. Today I'm going to talk to you about your recovery at home and the things that you can do to ensure that this process goes smoothly. You may experience some pain and discomfort following surgery, which is normal, and this will get easier. This is why it's important that you move as soon as possible following surgery, as this will speed up the healing process. It is important that you take your painkillers as prescribed, as these will keep you comfortable and allow you to be more active. It is important that you pace yourself when you get home. This means doing little and often, and gradually building up the activities that you do and the length of time that you do them for. Doing too much too soon or not moving enough may aggravate your symptoms, which is why it is also important that you do not sit for too long and that you move regularly throughout the day. In the early stages following surgery, it is important that you find a position of comfort to help control your pain and allow you to sleep and rest. These are some comfortable sleep positions: lying on your front with a pillow underneath your tummy, lying on your back with a pillow under your legs, lying on your side with a pillow in between your legs, and if comfortable, a small pillow or towel under the natural curve of your waist. It is a good idea to practice these sleep positions in the run-up to surgery to see what works best for you. It is important to maintain a good sitting posture as much as possible when you go home. Ideally, you will need to sit in a firm, upright chair with a back support. Make sure your bottom is at the very back of the chair and you are sitting straight and evenly. Use a cushion or a towel to support the natural curve in your back, but only if it is comfortable to do so. Your knees must be level with or lower than your hips. And when using a computer, remember to keep your chair pulled in close to the desk with your elbows loosely by your sides. The keyboard and mouse must be kept close to you and the computer monitor at eye level. Try not to sit for longer than 20 to 30 minutes initially. Remember, it is important to move regularly. When standing, keep your feet hip distance apart, with your head up and chin tucked in, maintaining a long neck. Keep your shoulders relaxed and make sure there is equal weight through both your feet. Remember to pace and build up the amount of time that you stand for. Avoid stooping as much as possible, for example, when brushing your teeth or leaning over to do the washing up. Avoid excessive bending or heavy lifting to begin with. Going forward, you must always avoid lifting anything that makes you strain. For the first 2 to 3 weeks, do not lift anything heavier than 10 pounds or 5 kilograms. After this, you must not lift any more than 20 pounds or 10 kilograms for the next 2 to 3 months. When lifting an object, start by placing your feet hip width apart with one foot slightly in front of the other. Bend from your knees and your hips, and you may allow your back to bend slightly as well. Make sure that you hold the object close to your body and gently brace your abdominal muscles while lifting. Exercise is an essential part of your rehab, and it is very important that you start these exercises as soon as possible following surgery. We also strongly recommend that you start doing them in the run-up to surgery, preferably at least 6 weeks prior to your operation. These will help increase your strength, mobility, and general function. This will allow for a quicker discharge from hospital following surgery and a faster recovery once you are home. Start by lying on your back with your knees bent and your feet flat. Gently roll your knees to one side as far as comfortable. Hold for 1 to 2 seconds and then slowly return to the start and repeat on the opposite side. Slowly repeat times 10 on each side. Lie on your back with your knees bent and feet flat. Gently squeezing your bottom muscles and pull in your lower tummy muscles. Start to lift your tailbone, Feel your back flattening onto the bed. Hold for 5 seconds and repeat 10 to 15 times. Lie on your back with your knees bent and your feet flat. Pull one knee to your chest and hold for 10 to 30 seconds. Return to the starting position and repeat on the other leg. Repeat 2 to 3 times on each leg. Lie on your back with your knees bent and your feet flat. Place your hands on the front of your hip or pelvic bones and gently pull your belly button towards your spine. You should feel a slow and deep tension under your fingers without any superficial abdominal activation or movement of the pelvis. Continue to breathe steadily and hold this for 10 seconds and then repeat 5 to 10 times. If you can hold easily for 10 seconds, try the progression. So whilst maintaining abdominal tension, slowly slide one leg or heel on the ground to extend it. Then slowly bend it back up to return to the starting position. Maintain steady abdominal breathing throughout the exercise and ensure your back stays flat on the floor. Repeat 5 to 10 times on each leg, but only straighten the leg as far as is comfortable on the operated side. Do not push into pain. Sitting straight with your back supported on a chair, slowly straighten your operated leg and as you do, point your toes away. Only straighten as far as is comfortable. Then slowly bend your knee back down whilst pulling your toes up towards your shin. Slowly and smoothly move between these movements without holding, but do not push into pain. Repeat 10 times on the operated leg only. Lie on your side with your knees and hips bent to 90 degrees. Keep your heels together and slowly lift the top knee away from the bottom knee without allowing the trunk to roll backwards. Hold for 5 seconds and then slowly lower down. Repeat 5 to 10 times on each leg. Following lumbar fusion surgery, you will not be routinely referred for physiotherapy. So from week 4 onwards, you may feel ready to progress and commence the advanced exercises. Only progress onto these exercises when you feel ready to do so. Your pain should be well controlled and you should be managing all the previous exercises easily. For some people, it may take longer to get to this stage. Start by lying on your back. Gently squeezing your buttock muscles, tucking your tailbone underneath you and flattening the spine. Gradually lift your bottom off the bed, aiming to lift one backbone off at a time, peeling your spine off the bed. Only lift as high as is comfortable. Hold this position for 10 seconds and slowly lower. Repeat times 5 to 10 repetitions. Lie on your back with your knees bent and feet flat on the ground. Activate your lower abdominals by bringing your belly button inwards. Maintain steady abdominal breathing while you extend one leg without touching the ground, keeping your back flat on the floor. If your back arches away from the floor, you must stop this exercise. Hold each for 5 seconds and then slowly return to the initial starting position and repeat on the other side. Repeat 5 to 10 times on each leg. In sitting, cross your arms over your chest. Then lean forwards and stand up slowly and smoothly without using your arms. Slowly sit back down without using your arms, keeping control of the movement. Repeat 5 to 10 times. Stand in front of a set of stairs or a step, lightly resting your hand on the banister, but for balance only. Place one foot on the bottom step, followed by the second. Then lower the first foot back onto the floor, followed by the other. Repeat 10 times on each leg. Increase the repetitions and the speed at which you do this as you feel able to do so. In standing, with your hands resting lightly on the back of a chair if you need to, and your feet in line with your hips, slowly bend your knees into a squatted position and hold for a count of 10 seconds. Then slowly push back up to standing. Start off with small squats, and as you feel more comfortable, increase the depth you squat to. Repeat 10 times. When considering returning to activity, you can only return to certain sporting activities after a certain period of time in order to allow adequate healing to take place. Swimming can be commenced at 4 to 6 weeks following surgery, cycling at 6 weeks, Pilates at 6 to 8 weeks, running and gym work from 12 weeks onwards. Returning to work will be between 4 to 12 weeks, depending on the type of work that you do. Returning to manual jobs will take longer, and we recommend that you seek advice from your consultant or physiotherapist regarding this. It may be worth considering a phased return to work following surgery. You will find all of this information in the physiotherapy advice and exercise booklet. Please remember, we are here to support you throughout your journey, so don't hesitate to contact us if you have any questions or concerns.